Hello, this is about a 58-year-old gentleman who came with the chief complaints of pain in the back following a fall. And this is MRI which shows L1 and L2 compression fracture. So we have opted for percutaneous fixation in view of his persistent and excruciating pain. So what the percutaneous fixation means? The percutaneous fixation is nothing but we are putting the screws through the skin without opening or ripping off the muscles. So once we put a screw and stabilize, the patient can be mobilized on first post-operative day. So this is L3, L2 and L1. In L1 you see the widened interpedicular distance, which means it is a burst fracture. So we are fusing from D12 to L3.
How long this will take, sir?
2 hours. You're fixing the C-arm table in AP and lateral position under C-arm guidance. First you take the AP and you direct it from the upper lateral quadrant. So the tip of my Jamshedi needle is on the lateral side of the pedicle and I'm going to direct it onto the upper lateral quadrant of the pedicle. So I'm entering from the upper lateral quadrant of the pedicle, directing towards the lower medial quadrant of the pedicle. And this is the direction I am going to place the screw. That is the position of the dilator. So this is a cannulated screw. I pass it through the guide wire. It guides me through the same track which I have done before, and through the guide wire I just introduce the screw. So this is how I introduce the screw. So in the same way, I have introduced all the screws at D12, L1, L2 and L3. So the next step is the rod placement. After the rod placement, the top screws are introduced and tightened in this fashion. This is a top nut and this is how I introduce inside and fix it. Good. So now I'm removing the connectors. We have seen the demonstration of minimally invasive spine fixation, which is percutaneous fixation. The advantages being the lesser blood loss, lesser muscle damage, lesser hospital stay, faster recovery, and lesser muscle scarring. Thereby, postoperatively, the patient is very comfortable and he can walk right from the first postoperative day. So, compared to the open surgery, I would suggest going for the minimally invasive spine surgery for the advantages it has.